I'm Dr. John Stenberg at Zenith Chiropractic in Colorado Springs, and for about the next 10 minutes, I want to give you a brief introduction to NeuroStructural Chiropractic. I talk to folks all the time that want to know what's the difference between your approach and, conventional chiropractic, what most folks think of when they think of a chiropractic experience. And so there's a few really important concepts to understand to answer that question and to introduce you to this approach. And that is the fundamental principle behind what we do, the process that we use to apply that principle, and I'd also love to share with you some real stories about patients who have gone through that process and what their experience has been like, as well as to introduce you to the primary condition that we work with in the clinic, which is called Atlas Displacement Complex. And there's some other terms that we use to identify that, such as the upper cervical subluxation, but for the sake of simplicity, we'll refer to it as Atlas Displacement to keep everyone on the same page. Now, our key principle behind NeuroStructural Chiropractic is that structure determines function. When we think of a conventional chiropractic approach, most folks think of generalized manipulation that is focused on increasing range of motion, reducing muscle spasms, temporarily alleviating or eliminating pain. And that's a fairly accurate description of a conventional approach. And there's a lot of different ways to do that, but in essence, those goals remain the same. Now, with the NeuroStructural Chiropractic, we want to really specifically apply the principle that structure determines function to the way that we implement chiropractic care. And so what that means is when we think about this concept, it applies in various areas of life, right? When you think about any type of contract that you might sign, whether it's a mortgage loan, for example, or a retirement plan that you might structure, you can think about it in terms of a will even, or an agreement with a business partner. Those need to be structured in a certain way so that they function to the mutual benefit of both parties. And in fact, you can apply this even on other levels, which is healthy relationships contain a certain level of structure and balance to them so that they perform optimally. And also in a company setting, there's a management structure in place so that everyone is performing functions for mutual benefit within the company. And our key premise is that that principle applies to our healthcare and the way that we care for the framework of the body, which is your skeletal system, with the spine being the foundation of that system. So in a very brief sense, optimal structure is essential for optimal function. Optimal function is when the body has a high level of stress resilience, meaning that it's able to handle the stresses of life without breaking down. Now, when it comes to the stress of the structural system, there are two factors that none of us can escape. It's time and gravity. So if you think about having a structural instability in your house, say a crack in its foundation, not only do those get worse over time, but they become more and more unsafe, and the long-term damage associated with that minor shift becomes more and more prominent. So when we think about stress resilience, it's all about mitigating the risks of the negative effects of stress, making sure that the body is able to handle the effects of stress and adapt to those changes in the same way that going to the gym and doing the workout is a stress to your body, but it has a specific outcome in mind. It's to adapt and become stronger, faster, fitter. And so with that in mind, we want to emphasize that function is essential for stress resilience, and we want to make the body less susceptible or less vulnerable to the negative effects of stress, especially in the structural system. So what's the process of applying that principle? It generally happens in 4 distinct phases. Number 1 is the start, which is an initial consultation, and this is a complimentary service that I provide so that we can accomplish a number of goals. Number 1, to determine if neurostructural care is the appropriate approach for your needs, to learn a little bit more about the health challenges that folks are experiencing, what they'd like to see improve in their overall health and well-being, as well as the history or the context around what got them to this point, where we have things that need to improve. So the key objective of this first step is to identify needs and goals on behalf of the patients, and to talk about the process like we're doing now, and also to identify if this is a potential solution. Now, if that's the case, then the logical next step is to perform a detailed evaluation. This is the diagnostic testing that provides us with a baseline level of data to guide the process of correction over time. So what that means is we do a lot of testing and a lot of measuring to determine exactly where the problem's coming from, what additional compensations or secondary problems have developed as a result of that, and what's going to be the most appropriate and systematic way to work through those priorities to get you to point B. Now, point B is determined by the goals that we talk about in the consultation, a reasonable expectation of improvement based on our objective testing, and a mutual understanding of what it's going to take between the doctor and the patient to achieve those goals. So a care plan is not a cookie-cutter approach to just having a series of adjustments over time, but it's more of an individualized program of care that is going to contain specific recommendations for two different areas. Number one, what I, the doctor, can do for the patients that they can't do for themselves. And number two, what the patients need to do in terms of lifestyle modification, corrective exercise, structural rehabilitation, etc., that I can't do for them. And it's really the marriage of the two and the synthesis of the two that allows us to take the information that we gather in a consultation, combine it with the data that we measured in an evaluation, and create a system to apply over time to notice a measurable level of improvement with those vulnerabilities. So once we accomplish that, so at the completion of a plan of care, the logical next step is to measure progress. So we're going to retest and recheck those metrics that we measured as vulnerabilities in the beginning, and we want to see, did those improve? Have we reached the goals that we'd set out to reach? Is there still additional room for improvement? And if so, what is the next step to make that additional progress? And if we're happy with the progress that we've made and we've achieved our goals, then we need to look at what are long-term strategies to maintain this level of progress and to protect the investment of time, energy, and resources that it's taken up to this point to achieve that progress and not to regress. So I want to just share a few stories about real people who have gone through that process or are going through that process and what their experiences have been. B is a gentleman from Kansas who comes to Colorado Springs roughly every 6 weeks for a checkup and adjustment as needed as a part of his care. He has a condition called Meniere's disease. It's a very debilitating disease that includes vertigo, a feeling of fullness or a plugged ear, ringing in the ears, as well as the side effects of not feeling well and not being able to work, which is depression, anxiety, and feelings of not being able to contribute in a meaningful way to the family and engage in passions and hobbies. And so with this gentleman in particular, when it comes to the vertigo being one of the primary symptoms, we noticed that while going about correcting his spine, we've noticed an improvement in the vertigo to the point that he's no longer spending days and weeks stuck in bed with nausea and vomiting and debilitating vertigo, but those episodes have become much less frequent, much less severe, to the point that he's now able to engage in projects around the house, to do some of the things that he's really excited about doing and passionate about doing, which is working with his hands and being able to make improvements on the family home, as well as what his wife described to me as being more like himself. So having some of that personality come back as a byproduct of feeling better. JG is a woman that I am working with who's experienced chronic 3 to 4 times a week migraines, as well as a secondary complaint of shoulder pain, and just this constant ache in the shoulder when moving it around. She's been a patient for just a few weeks now and has had, I think, just one adjustment, and has already noticed that the shoulder pain is completely gone, so that has been resolved after one adjustment. And the chronic 3 to 4 times a week migraines have improved significantly, down to the point where she might have one per week, and at best, some mild tension instead of a chronic, rip-roaring migraine headache. Again, only a few weeks into the process, already noticing positive results. CC was a woman that we worked with for several months who had to medically retire from the police force due to multiple herniated discs in the lumbar spine, which are very painful and unstable injuries, things that produce a significant amount of low back pain, leg pain, and chronic foot pain, and as such, not able to be as physically active, gaining some weight, not feeling as good, all the things that go along with living in chronic pain for 15 plus years. After working together for several months and only needing to do a handful of very specific targeted adjustments in the upper neck, she was able to be pain-free for the first time in almost 20 years. We've been able to maintain that progress for a significant enough amount of time that she's able to start working out again, losing some weight, and just returning to a better level of physical performance as a byproduct of feeling much better and having a new lease on life, considering that issue that she thought she would have to deal with forever has been disrupted in a very meaningful way. So as you're looking at these stories and the different types of symptoms that we've discussed related to each of them, you might wonder, what do these people have in common? How does someone with vertigo have a good response, with someone with shoulder or neck pain or migraines has a good response, and someone with low back and leg pain has an equally good response? And there's a common thread underlying each of these stories, which is where we really focus in neuro, and that's on a condition called Atlas Displacement Complex. And this is, again, a term that we use to describe a condition called the upper cervical subluxation complex, but Atlas displacement will suffice for the sake of simplicity. And what this is a structural injury to the top of the spine, or the junction between the head and the neck, that produces a number of side effects, being faulty mechanics, body imbalance by way of postural distortions, and subsequent nerve system irritation. Over time, as these side effects start to progress, the onset of one or more secondary conditions is likely to develop. The secondary conditions are also known as symptoms, but we call them secondary conditions because, as the name implies, they're happening because there's something causing them. So some of the common secondary conditions for Atlas Displacement Complex include headaches of various types, vertigo and dizziness like we discussed, shoulder and arm pain, and you can include neck pain in with that, brain fog and difficulty concentrating, and I would also put in there fatigue along with that one, as well as numbness and tingling in the hands, fingers, and arms. And these are all very common secondary conditions that we see in folks that have Atlas Displacement Complex. Now, the trouble with that is that these symptoms or secondary conditions are shared by a number of other issues. And so when most folks are navigating dealing with these problems, one of the most commonly overlooked variables or factors is, do they have an Atlas displacement? And if this continues to be overlooked and is contributing to the onset or severity of these secondary conditions, you'll never achieve a full resolution without addressing this structural injury. And that's where we focus in neurostructural care, is identifying if you have this problem, the nature of this problem, and how we need to go about correcting it for you. So some clues to consider if you or someone you know is experiencing these types of conditions and is wondering if this Atlas displacement might be a part of their problem. There's a few things to consider, and these are things that I hear in the office all the time, which is, man, this problem came out of nowhere. There's no real reason why I should be having this neck pain or this headache. It just has gradually been building over time, and now it's to the point that I can't put it off anymore. I need to do something about it. Another clue would be crunching or popping sounds when you move the head and the neck. Now, this is a common thing, but it's not normal. This is signs of instability in the cervical spine or in the neck, which is a very common byproduct of an Atlas displacement. Almost without exception, in a consultation, when we talk about a history of injury, almost all of my patients have experienced some sort of accident or head and neck trauma 10 to 15 years prior. And that could come in the form of a car accident, a slip and fall, a sports injury, a concussion. There's a lot of different ways this can happen, but it seems that this window of 10 to 15 years prior tends to be where that injury took place. That's when these processes got set into motion, the faulty mechanics, the body imbalance, and the nerve system irritation. And without addressing those areas specifically, the wear and tear associated with them builds over time to the point where problems come out of nowhere. So a couple other things that are common clues that we hear about are things such as, all the tests came back normal, but I still have this problem. And the problem with that is if the MRIs, the CTs, the nerve conduction studies, the blood work all comes back normal, then we may be overlooking a subtle structural injury that could be underlying what you're feeling. And last but not uncommon is the statement that I've tried everything. Conventional chiropractic, physical therapy, acupuncture, I've tried medicine, I've tried supplements, I've tried herbs. Nothing has seemed to work for me. And there's a reason why folks that say this tend to do well if we find that they've got atlas displacement. And the simple fact is, back to our key principle, structural problems require structural solutions. You can't fix the hole in the basement of your house with Drano, right? You need to have an appropriate solution for the problem. And so if we're trying everything and not getting a resolution of our symptoms, and it's been multiple weeks where you're dealing with these types of conditions without relief, then we need to start to look at considering things a little bit differently and identifying if there's another injury that happened at some point, produced an atlas displacement, which has been left uncorrected. So just in summary, as we close up here, the key fundamental principle is that structure determines function, and when it comes to the spine, the upper portion of the spine is the most movable and susceptible to injury. So if you are to have structural stress affect your system, it's going to affect the weakest link in the chain, which happens to be the upper neck. This is how an atlas displacement can be produced. When that happens, there are a number of symptoms or secondary conditions that are likely to develop. These are the warning signs from your body that something is wrong. So the way that we implement a process of correction is by starting with a simple conversation, and that happens in the form of a consultation. That's to, again, identify needs and goals on behalf of the patient, to understand if this is a potential solution for the person and generally what the process will look like. The next step is to perform a detailed evaluation and to measure that they do have an atlas displacement and what's the best way to go about correcting it for that person. We implement a customized plan of correction geared to stabilize and correct that problem as much as possible, given that you should not require frequent adjustments to feel and function well. So one of the highlights with that plan is you don't have to be adjusted all the time, and it's not just a series of adjustments over time, but rather a process that requires the customized pieces of the puzzle for the person to meet those goals and to achieve those structural results that we would like to see accomplished together. So my invitation is to schedule a complimentary consultation. If you think that this might be going on for you, if you've experienced some of those secondary conditions that we've talked about and you're trying to find relief or long-term strategies, it's worth exploring if there might be an atlas displacement that is contributing to what you're feeling. If that's the case, then we will develop a specific plan on how we can work on improving that for you. And if it's not, then we'll have a very good idea of what the logical next step would be to explore for you to find the relief and hope that you're looking for. With that, I would also like to extend $50 off a comprehensive neurostructural evaluation this month only during March 2019 for folks that have watched this video and have educated themselves on this particular focus in chiropractic, our unique perspectives, our unique process, and also the condition that we work with. As you can see on the right side of the screen here, we use a 3D multi-axial imaging to identify any structural disturbances there are. So one last point to consider with NeuroStructural Chiropractic is that as we're implementing our adjusting procedures, we don't have to do any twisting, popping, or cracking of the neck, which is a very nice feature. So we're able to do adjustments that are targeted, precise, effective, and safe while introducing stability rather than just generally manipulating and loosening up the neck. So If you would like more information, I would encourage you to reserve a complimentary consultation, which is again just a simple conversation to start the process.